So after cementations, and this is what look like the patient can get. The full. The full mouth implant cases, we always diagnosis is first. It's much better idea than we made the wax try in, and then they made the temporary. So dentists have to contact to dental laboratory and then ask them their professionalism. Okay, so please listen what they said, because like we did so many full mouth zirconia, we made it. So we've been seeing so many different implant direction, or deeper, or above, or misaligned, or sticking out the facial. So this video I would like to share, I do have a little bit challenging case which is face in, trying to let you know how can we fix the issue. Okay, let's say I'm not a dentist, I'm a dental laboratory technician. So let's say the dentist put the full implant at the top, no matter what reason. Okay, that they have a bone, there's a nerve, whatever. Okay, they put the place for implant in. The first we have to watch out the subgingiva, which is way deeper. This is the measuring. So almost 6 millimeter down. 6 millimeter. This is more even. So that one is a cause the problem. My future restoration, which is the chimney type, which is very thin, which is zirconia, and then we made the tie base. Okay, tie base, cemented, and after put in to the patient's mouth, which is not the same case, but exactly the same case, kind of. After they made it, think about it. Looks fine. Right, it was okay right now, but after 3 months, 6 months, or depends on the lower problem. Okay, lower problem is especially like I said, the partial here, natural teeth all grinding. This is a bingo. Okay, bingo meaning 30 days later, 2 months later, 90 days later, bingo, it's a cracking. No matter what, who made it, no matter what, we made a thick here, we're going to cracking, because that chimney. Okay, chimney is extremely problem. It's so deep, thin, and then maybe cause a problem is a fitting issue. Okay, it's a two issue. And number three, and here is, you see the here between the here is there. The pontic size is way bigger than normal, which is above exceed the pontic design. They cause the problem is this a cracking problem. I hate that. Okay, nobody like it. Whenever they chew the food, whatever they're cracking, how much they pay, whatever they pay, 10,000, 20,000, 30,000, 40, whatever, right? So I don't like it. So this solution, which is we made the Titan 7-star. I know you said all the time saw my 7-star. Believe me, sometimes 7-star I don't want to make that one. It's expensive. I really don't want to make that one. It's very complicated. It's very thin, getting losing my hair, make beautiful as possible. But sometimes I recommend that this is the hybrid bar, which is titanium. You see the deep. Okay, so I made it first. The fitting. Okay, this is the first step. But all the times I talk to my technicians, whenever they design it from here, so I have them design this is first, and then they make the frame design too. I'm trying to make the perfect size as much as possible, to make the shoulder as much as possible. If they have a problem here, that's always challenge, because some people is up higher, some people lower. So I would say most, 50% was okay, but 30% is big problem. They big smiling. Okay, so we cannot cover all the way that area because aesthetic. I know people complain about the hygiene, but I cannot do much about it. Whenever they're smiling, I want them to get the better smiles, not fake looking the gum line here and everybody see, or you made the whole bridge. I don't want that. That was covered it. That's the dilemma all the time. But whoever did not move it, that's fine. We're trying to make the hygiene as possible, or the implant position supposed to be right, but it's pretty tough. It's not easy like that. So this solution we fabricated, and then the top of that, so we made this one, okay, zirconia, and then just put together, slick together, just like slick. Okay, I know a little bit hygiene here problem, but I cannot do much about it. Like I said, this is what patient looking for. But the doctor and I looking for more than hygiene, the occlusion, chewing, comfortable, facial thickness, those kind of things. But the lingual is pretty good. So my suggestion here is they can make I don't have to make chrome cobalt. So this is titanium hybrid bar. Just put it in there, and then just make sure the all tissue cover it, so there is no open. Okay, and then they cover with this, then they can get it. So we're going to cement this one soon. Okay, this is another solution for that. So we call Titan Tie Direct. Okay, so for implant, remember, deep subgingiva, the wide pontic size, which is the very heavy, especially look at it, the opposing tooth, especially who has a partial natural teeth grinding, this is a bingo. There's a less than 1 month, just like that, crack, just crack. Everybody frustrated. So I'm glad I cut it. So we let doctors know. Price a little bit different. It's a little bit higher than normal. Normal meaning is regular regular zirconia restorations. Okay, normal regular zirconia restoration, just like that. So this is higher, but it's worth it. Still, we're trying to make the little thin as possible, the lingual size. So that's our final bet. So this old problem, we're going to solve it, and then to get the better restoration to the patients, not only the aesthetics, and then this is the final solution. So this video, so I hope you guys have much about this, my video types. So all the times, like I said, different implantology, different implant option. The deepest about subgingival area, huge pony. So they have to considering as much as possible before go to the final. Again, so I'm not a dentist, so I will only talking to the dentist with a prescription. So we do have over 46 state dentists who send here all the time. So give us a mail, then we can contact our client with no charge, so they can get you. And the problem, if you have same problem, that'll be great. So we help you as much as possible. And send us mail at lsk121.com. Thanks for watching my channel. And it's tough to do video all the time, but appreciate it. You guys keep watching it, and I can bring better the video and better education video for you too. And then if you see my restoration, all those kind of things, go to social media, Facebook, Instagram, and the LinkedIn, so you can see so many cases what we've been done that. Appreciate it. Have a great day. Thank you. So after cementations, and this is what look like the patient can get the full. So this is occlusion, and so like I said, we have to see the tooth movement in between the teeth. Okay, we'll open it, and then I just make sure check the freedom of the tooth. You see it's very tight. So we give them a little bit of freedom of the tooth, and the movement to here. See, the problem is whenever patients bite down and the natural teeth is more forward to the occlusion contact instead of the denture, instead of the partial, right? So this is final. So before they go to the nighttime, so they can use the night guard, so they can get this perfect symmetry. All right, thank you.